One night, Lena with her friends and Jake with his friends both end up at the same party. The two of them bump into each other and hit it off. 1 year later, they are making plans for the rest of their lives together. Lena and Jake decide that they want to have a family together. They make an appointment with Dr. Walsh to discuss their future. Lena and Jake explain to Dr. Walsh that they are thinking of having kids. She congratulates them. The doctor recommends looking into their family health history. They can use their family's medical information to see if there are any diseases common in their families. This will help them figure out if they are carriers for certain diseases. If they are carriers, there's a chance that their children could inherit. Lena and Jake go home and get on their phones. Lena calls her parents and talks about different diseases that they have had. Jake's mom has passed away, so he calls his dad and his mom's sister. They also look through medical documents, insurance filings, death certificates, etc. Through talking to her family, Lena realizes that she has a family history of sickle cell anemia. Both her grandfather and her cousin Molly had the disease. Jake doesn't see a pattern in his family history, or at least no visible diseases. They talk to Dr. Walsh, and she suggests Lena get tested to see if she is a carrier. If she is, Jake can get tested later. Dr. Walsh takes a blood sample from Lena and sends the sample to be tested in a lab. 1 week later, Dr. Walsh calls them back in to get the results. Lena's test has shown that she is not a carrier for sickle cell anemia, but she is a carrier for a disease called cystic fibrosis. Jake gets tested as well, and his results come back positive for that gene, meaning he is also a carrier for cystic fibrosis. Therefore, their children have a 1 in 4 chance of having cystic fibrosis. Dr. Walsh explains that they have a few options at this point. They can continue trying to conceive on their own, as there are treatments for cystic fibrosis if their future child does have the disease, or they can select an embryo without cystic fibrosis through a process called pre-implantation genetic diagnosis, also known as PGD, in combination with in vitro fertilization, otherwise known as IVF. They also can look into adoption or decide not to have kids. Lena and Jake choose IVF PGD with the help of Dr. Walsh. And in 9 months are the proud parents of a bouncing, healthy baby boy. If you're thinking about starting a family, talk to your doctor about your family health history and carrier screening.